Well, good morning, everybody. My name is Mike Velico. I'm the president and CEO of ImpactLife. It is my pleasure to be here with you this morning celebrating this tremendous day. As we enter our 50th year of providing life-saving blood products to more than 120 hospitals and emergency medical providers across our four-state region of Iowa, Illinois, Missouri, and Wisconsin, I am extremely proud of the ImpactLife team and the relationship we have developed with Velico. Here at ImpactLife, we have 4 pillars to our strategic plan. 1, focused on our team. 2, engaging our dedicated donors. 3, working with our partners in the transfusion medicine space. And 4, advancing medicine. This partnership with Velico fits perfectly with all 4 pillars. The ImpactLife team is thrilled to be leaning forward, advancing medicine, taking care of patients with the help of our donors. Our vision to impact lives with a dedicated team, engaging donors, supporting our partners, and advancing medicine also meshes very well with Velico as we look forward to bringing frontline on-demand plasma to the healthcare continuum. This blood component will improve healthcare and patient outcomes by bringing frontline ODP to the location it is needed most, pre-hospital transfusion. Pre-hospital transfusion has been shown to improve patient outcomes when patients can receive a needed blood component at the scene of an accident or while en route to hospitals. ImpactLife works with emergency medical service providers on pre-hospital transfusion, providing EMS teams with the ability to carry blood components on board air and ground ambulances. As of today, we support 18 organizations around our 4-state region with pre-hospital transfusion services, and more are asking for this assistance every day. Additionally, as we prepare to bring this technology forward, we are making a multi-million-dollar investment in our manufacturing operations here in Davenport. The team has been working diligently with Velico for the past few months, planning and preparing our operations for delivery of the specialized equipment needed to manufacture frontline ODP. This investment will ensure that our mission to save lives by providing blood products and services to communities in need will continue for the next 50 years. Thank you for being here today with us, celebrating this advancement in medicine.
Thank you, Mike. So my name is Bill Skillman. I'm a senior vice president at Velico and a board member. And something I need to tell you is I have Parkinson's disease. And when I start to talk about something that I get excited about, like spray-dried plasma, the tremors may start. So if you see it, know that I'm excited and love what I do. But the other thing that I wanted to point out is that, we're really proud new partners of ImpactLife. We've worked with them over several months. And as we've gotten to know the team, it's just the enthusiasm, they're forward looking. They embrace blood beyond just the product. And they think forward to the patient. And that's a great place to be. But at Velico, our singular focus is to minimize preventable deaths from bleeding. So what I'm about to share with you is more than just a corporate achievement or a professional milestone or just another business deal. It's a personal dream coming true. A dream of delivering technology with the promise of saving tens of thousands of lives around the world every year. And I'm thrilled that ImpactLife shares our vision and will be playing a pivotal role in delivering on that promise and making that dream a reality. So let me give you a little bit of background. In the fight against preventable death from bleeding, the stakes couldn't be higher. Every year, thousands of lives are needlessly lost because of uncontrolled hemorrhage. In the US alone, that amounts to over 50,000 lives a year. The numbers are incredible. And in my book, that's way too many, especially when you think that you or someone you love could be one of those casualties. But there's hope, and a solution is on the way. We've learned from military battlefields, civilian pre-hospital blood programs, in clinical studies that there's one thing that can make all the difference in the world, and that's having blood at the point of injury. You see, when someone's bleeding, they need blood, and they need it fast, and they need it where they are. So today, with ImpactLife at our side, we're taking an enormous leap forward in the fight against preventable death from hemorrhage. We're joining forces to provide life-saving blood products exactly when and where they're needed most at the point of injury. And although many pioneering EMS agencies across the country have developed successful blood programs, the conventional liquid blood products that are available aren't ideal for use in the pre-hospital setting. The combination of short shelf life, demanding cold chain logistics, limited supply, and constant recycling to hospitals to avoid waste causes excessive manpower costs and high costs of service, none of which are currently covered by Medicare or third-party payers. So, I'm going to digress a little bit from my notes. Most people that I meet think that blood already exists on ambulance, and it doesn't, and it's not being paid for, but there's also a solution to that ImpactLife is part of. But, with facing those kind of issues, it challenges the sustainability of the programs that are already existing and really limits the new ones that can come into play. So I'm really pleased to report that this change really begins today with our partnership with ImpactLife. I'm really proud, I'm absolutely thrilled to announce a groundbreaking collaboration with ImpactLife, which will equip the blood center to produce a spray-dried plasma product called Frontline On-Demand Plasma, or Frontline ODP. Frontline ODP is a dry product that rehydrates in minutes. Try not to mess up your mics here. It rehydrates in minutes at the point of care with sterile water for injection. Another Parkinson's issue. My fingers don't work as good as they could. But this is the product. This will be the end product. We supply an instrument that'll dry liquid plasma, and then a sealing and separating and final packaging device. But this is the product. You guys in the back that can't see, looks like that. Did you ever imagine that blood could look like that? So that's available in an ambulance. And I'll pass that around so you can have a look at it yourself. We're currently finishing up a clinical trial in the United States and expect to be licensed by the end of the year, next year. So coming soon to a blood center near you. So ImpactLife is joining Velico's Blood Center Education Program, or what we call BCEP. It's a program funded by Velico and the Biomedical Advanced Research and Development Authority, or BARDA, which is part of Health and Human Services in Washington, D.C. Under the program, ImpactLife will acquire a complete dry plasma manufacturing line and the funds necessary to fully integrate the system into its blood component operations and to make the necessary regulatory filings. ImpactLife will be joining a limited strategic network of forward-thinking, patient-centered blood providers with a passion for eliminating preventable death from hemorrhage and improving pre-hospital care. Now, as I've gotten to know the team at ImpactLife, I mentioned earlier that their interest, their efforts are more than on just producing high-quality blood products. They're at the forefront of change, shaping the future of emergency medical care. And Dr. Hermelin, our blood bank barista, if you haven't seen one of her webcasts yet on LinkedIn, you have to check it out. Google blood bank baristas, or you can see her and she'll give you a link. But I'm really pleased to point out that members of the team have joined the National Pre-Hospital Blood Transfusion Initiative Coalition, rolling up their sleeves and doing the hard work to make reimbursement a reality and to change scope of practice guidelines across the U.S. so that blood can be available on every ambulance in the United States and that it can be safely transfused by paramedics across the nation. So today I'm deeply honored to share the podium with Mike and the incredible team at ImpactLife. Together, we're marking this historic moment. Together, we'll enhance the practice of pre-hospital medicine by adding a new life-saving treatment option to the EMS toolkit, one that will change the face of pre-hospital medicine. So I want you to imagine a world where there's a blood product on every ground and air ambulance. And imagine that the person whose life might be saved might be a loved one or it might be you. It's a dream that I've had since 2014 when I joined Velico Medical. I can see the light at the end of the tunnel, but it's not something that you can do by yourself. And with the folks at ImpactLife, we're bringing that life-saving solution here. So dreams really can come true. And with ImpactLife, we're turning dreams into reality. So I appreciate your partnership. I appreciate your support. I appreciate your enthusiasm. And I love you all like crazy. So thanks for all turning out today. Thank you.